Hey, good morning. Time now a minute after 8 o'clock in the morning in Tokyo. The date is Friday, October 14th, 2022. Welcome to another edition of the World Bank online seminar organized by the Tokyo office team. My name is Koichi Mori. I am the Senior External Affairs Officer of the World Bank based in Tokyo. We organize a series of online seminars starting at 8 o'clock in the morning in Japan Standard Time, introducing the latest report presented by the World Bank Group economists and specialists. Today, we are featuring the latest edition of a latest report, which is titled Building Resilient Migration Systems in the Mediterranean region, subtitled Lessons from COVID-19. This report was released in June this year. Connecting from the Washington and New York, actually, we have two specialists and co-authors of the report. Let me introduce each one of them very briefly. Mauro Destaverde, the senior economist in the Social Protection and Jobs Global Practice of the World Bank, connecting us from Washington. Mauro, good evening, good morning to you. Thanks for joining.
To you, Koichi, and good morning, everybody.
Great, thank you very much. Mauro is, for Mauro, this is his second appearance in the program. In fact, he appeared nearly several years ago when we were organizing still 6th or 7th session of the morning seminar series. So welcome back to the program. Thank you. We have Jacqueline Pavillon, who is a deputy director of the Center for Migration Studies of New York, connecting us from New York today. Jacqueline, good evening, good morning to you.
Good morning to all of you. Thank you very much for the invite. Happy to be here.
Great, thank you very much. So we'll be listening to Mauro and Jacqueline presenting the main point of the report for the next 30-40 minutes. After their presentation, I'll read the questions that we received from the audience. And thank you very much for sending the question in advance. Please send your questions if you have more questions using the online form posted on the announcement page for the seminar, or you can simply post your question on the chat section of the YouTube screen. I'll read those questions and ask the speakers to respond after their presentations. With that, I'd like to ask Mauro and Jacqueline to come in formally and start your presentation. Over to you, Mauro.
Thanks, Koichi, and thanks again for having us. As you mentioned, I was here for another report still on migration a few years ago. It's nice to be back talking about migration, this time in the Mediterranean region. And as you said, this report was launched in June this year, so a few months ago. But actually, when we started, it was before when the idea of this report came to us, it was before the beginning of the pandemic. And this tells you all the importance that we felt migration has for the Mediterranean region. Then the COVID crisis happened, and we realized how we wanted to talk whether migration would still be such an important source of well-being in the Mediterranean region. So the focus of the report has shifted. And just to say that while Jacqueline and I are the main authors of the report, this is one of the few reports at the bank that see two regions coming together. So this has been sponsored by the chief economist for the Europe and Central Asian region, as well as the chief economist for the Middle East and North Africa region. So realizing the migration is not an issue related to one specific country, there is a sending side and a receiving side. Two different regions of the bank came together to produce this report. But what do we specifically look at in this report? The report is very long. We have more than 140 pages, but in essence, we do four things. First of all, we look at how COVID has disrupted mobility in the Mediterranean region. So we look at how migration flows have changed following the COVID-19 outbreak. And then we talk about implication for different players. So we focus on migrants themselves and their families. But we also realized that this crisis was not solely something that has to do with negative impacts on migrants, but there were also repercussions on receiving countries. As we will discuss in a few minutes, the COVID pandemic has highlighted very important lessons for sending and receiving countries to improve their systems. And finally, in this report, what we want to do is to document what countries have been doing during the crisis and also see what can be learned. So what are the practices that can be continued going forward to build what we call more resilient migration systems, so systems that are more ready to respond to shocks. Now, before we go into the description of the results, we thought it was useful to tell you what are the main messages, so you can keep them in mind as we go through the presentation. We think that the first message that the book highlights is that the COVID pandemic has showed that migration can continue safely in the wake of large global shock. As we will discuss, the COVID pandemic was very disruptive for migration flows, but people still moved because of the importance of mobility for the well-being of the region. So the first message is that migration can still continue even after large shocks, such as the COVID pandemic. The second message is related to some of the measures that were taken immediately after the COVID outbreak, and I'm talking about travel restrictions. And what we saw is that travel restrictions were immediately implemented to avoid the spread of the virus, but these are not by any means some sustainable solutions because they impose cost on migrants, on receiving countries, and on sending countries. So we really want to highlight the fact that basically imposing travel restriction is not something that can be prolonged in period of crisis. The third message is related to the response, to the policies implemented in response to the COVID pandemic. And more specifically, we look at human development policies, so policy related to healthcare provision, education, social protection, and employment policies. And what it became clear during the COVID pandemic is that if some groups of the population, in this case being migrants, are not included in their responses, the facts are now that it not only for them, not only for migrants, but also for locals and for economies in general. So covering everybody in period of shocks in, for instance, the pandemic is very important to avoid that there can be effects that are perpetuated over time on all the segments of the population. And then one last point, which we think is very important to highlight, is that crises usually trigger these times of confusion and chaos. And so there is a tendency to focus on the short-term impacts. But in the report, we also want to talk about some of the impacts that have not necessarily manifested themselves yet, but they can manifest themselves in the long term. And here we have in mind the implication of learning interruptions for migrants, but also some effects on attitudes toward migration and discrimination that can be amplified in the long term if not addressed. So I will start for the first few slides, and then Jacqueline will take over, and then we'll briefly conclude. Now, for those who are not familiar with the region, we thought it was useful to tell you what are specifically the countries we're covering in this report. So we look at 21 countries with a coastline in the Mediterranean Sea. So you can see them highlighted in light blue. But also we include countries that within this region are important receivers of migrants or refugees. And so we also include Jordan, even if the country doesn't have a coastline in the Mediterranean Sea. And also we include the 6 Gulf Cooperation Council countries because they are important receiver of migrants from the Southern Mediterranean. So in total, we have 28 countries, and basically we have really diverse migration flows because we have migration flows dominated by economic migrants. You can think about people going into the GCC countries. So people from Egypt, for instance, that they go work in construction or in other relatively lower skill sector in the GCC countries. We have refugees like Syrians in Turkey or in other parts of Europe. But also we have what we call mixed migrants, so a large number of people from the African continent trying to approach Europe, especially Greece, Italy, and Spain, crossing the Mediterranean Sea. So very diverse region, and a region in which migration has been a fact of life for many years. So just to give you an example of the importance of migration in the region, here we want to compare the share of, for each region, the share of the world population in that region, the share of the world immigrants, and the share of the world immigrants. So the Mediterranean and GCC region, so the first region, in the first region, you can see that around 25% of the world immigrants are in that region. So 1 in every 4 immigrants in the world live in the Mediterranean region. But the population of this region is only between 5 and 10%, so around 7% of the world population. So immigration and emigration are significant. Also, in the red bar, you can see that around 1 every 6 world immigrants come from the Mediterranean region. So migration is a fact of life, and is increasingly being so in the last years. So in the last 30 years, migration, the stock of immigrants in this region has tripled. So once again, just to reiterate the importance, a lot of migrants from the region stay in the region. So around 60% of Mediterranean immigrants stay in the region. So there is a constant movement of people in all directions and for all the different regions. So really migration is part of the vitality of the Mediterranean region. Now, in this context, what happened after the COVID outbreak? What happened after the first case of COVID in the region that was around February, March 2020? So what we can see is that literally all countries between March and May 2020 impose restrictions, either partial or full ban to the entry of foreign workers. So this will be the blue, the area in blue color in this graph. So immediate reaction was restrictions. And then this restriction in different ways and forms stayed until November 2021. So from being a region in which a lot of people move, in which migration is really part of is one of the characterizing feature, all of a sudden restrictions were imposed. So what does this mean for migration flows in the region? First of all, as you can all imagine, migration flows were affected, and particularly there were drops both in flows of asylum seekers and in flows of documented migrants. For instance, and as shown in this figure, the application for asylum around Europe really dropped in all countries. So in 2020 compared to 2019, there were large drops in first instance asylum application. And we see this increase in Italy, Malta, Spain. We also see a drop in the number of permanent migrants. In France, these drops were around 21%, 38% in Spain, and 35% in Italy. This is not only a phenomenon in the European part of the Mediterranean region, because it's something that we also see in GCC countries. For instance, in the Kingdom of Saudi Arabia, the number of work visas between the last part, so the last 6 months of 2020 and the last 6 months of 2019, dropped by 91%. So huge drops. So until now, we can think of a story of basically people stopping moving. But when we give a further look at the data, we saw that restriction partially halted migration, but they didn't stop people from moving in the months after the initial restriction. And this is before, if you think about the disparities in the region, you can think about the income level of some countries compared to others, and also the demographic pattern of some countries compared to others. The push factors, so the drivers of migration, are so strong that some people kept moving. And so when we see the number of land and sea arrivals in Europe, we can see that while in Greece, these numbers really dropped from March 2020 and never recovered in 2021 compared to 2019, the number of people trying to reach Europe through Italy and Spain actually increased in 2020 and 2021 after a few months of stall. So in a way, people at the beginning were a bit surprised by the arrival of the COVID pandemic, but then they kept moving. And this is because there were strong reasons behind it. And what is worrying is that they tend to use more the central Mediterranean route, the one going through Italy, which is the most dangerous. So you can start seeing patterns of people not being able to move, finding some restriction on their ability to move, but taking more dangerous route. And this is also confirmed when we look at what happened at the risk of migrants while they move. So for instance, here we look at some data collected in North Africa and West Africa for people in those countries. And they all report that their need for smugglers increased, and so increased the fees paid to the smugglers, and the routes that were used were more dangerous. So in a way, as the channel for documented migration are closed, people need to increasingly recur to smugglers to then still be able to live, and they pay higher prices. And this is something particularly problematic for women and girls, because we see that these phenomena are also associated to an increase of trafficking, or human trafficking. So in this situation, in other crises, we see that the increasing risk are also associated with increasing trafficking and smuggling. So something to take into account is that we are talking about the effects on the average migrants, but then this effect can even be more severe when we look at some vulnerable group like women and younger. So I think I'll stop here for now, and then I'll pass it to Jacqueline, and then I will conclude in a bit.
Thanks, Mauro. So as Mauro mentioned, the COVID-19 pandemic not only had an impact on migrants and their families, but had an impact on those countries that were receiving those migrants as well because of the mobility restrictions. So I'm going to first talk about the impact that the pandemic had on the migrants and their families, and then move to talk about the impact that them not being able to move, as Mauro mentioned, as easily had on receiving countries. So next slide, please. So one thing that we tried to document in the first part of this report is that migrants were much more exposed to the virus itself in terms of health impacts. And this has nothing to do with the inherent nature of being a migrant oneself, but because of the social determinants of health and economic conditions surrounding migrants, their living conditions, the types of jobs in which they're employed, having limited access to healthcare, and also certain pre-existing health conditions. In the top graph on the right, you can see that in northern Mediterranean countries, the blue bar, which represents foreign-born, a much larger share of the foreign-born than native-born population are living in overcrowded housing. You also see overcrowded housing in many living quarters that migrants are living in, such as detention centers, migrant dormitories in Gulf countries, refugee camps, and that exposes migrants at a higher rate to catching the virus. Also, in the lower graph, you can see the share of foreign-born and native-born workers that are able to work remotely. So the blue bar showing that foreign-born workers are much more likely to be in jobs that cannot be performed from home, meaning that they are frontline workers who are much more at work exposed to the virus. And so you start to see patterns in the types of jobs and the types of living conditions that put people more at risk. At the same time, in the report, we document that different migrants in different countries have different access to healthcare. That might differ by being a permanent migrant versus a temporary migrant. In the European Union, that might differ between being another European Union migrant versus a third country national. That might differ between having documentation or not having documentation. And so, in the Gulf countries, you might have employment-sponsored healthcare, or if you don't have an employment visa, you might be excluded. And so those are certain direct barriers, but we also see kind of practical barriers to healthcare, even where migrants do have direct access. That might be language barriers. That might be co-payments for insurance schemes for refugees that are too high. That might be unfamiliarity with systems or fear of disclosing one's status for emergency care, even where undocumented migrants do have access to health care. Certain vaccination schemes included undocumented migrants, but others did not. And so all of these things combined, dispose migrants more towards the health risks. In certain countries, it was documented that migrants in a World Health Organization 2018 report, migrants and refugees had certain pre-existing conditions such as heart disease, incidence of stroke and diabetes that were pre-existing conditions at higher rates, which again put people, migrants and refugees, at higher risk of developing more severe cases of COVID. And when you see the impacts of that on migrants' health overall, you see in documented in many cases in France, you see higher excess mortality among migrants than you do among native-born populations. In Italy, in Kuwait, you see higher rates of migrants being in ICU, often because perhaps they do not go to the hospital as soon as they should and develop more severe cases. So all of these things combined put migrants at a higher risk of having more severe health impacts due to the virus. Next slide, please. In addition to having more severe health impacts, migrants are also experiencing much more severe economic losses. And we see that in these graphs on the right. And this is showing the drop in the employment rates by quarter between 2019 and 2020. So being below that horizontal line, showing a drop in employment. So you see right after, kind of between Q1 and Q2, which would be the start of the pandemic, there are employment losses for both migrants and native-born workers in all of these countries due to the pandemic. But the green dots showing the foreign-born in Greece, in Spain, in Italy, facing much more severe employment losses. Part of that is because migrants are not able to work at home remotely at the same rates as native-born workers, as shown in the previous graph. And so there was either people had to go to work and be exposed to the virus, or they might lose their job at a higher rate. And so you see these drops, and while they do recover going towards the end of 2020, they don't recover nearly all the way, and those employment losses for migrants remain under that much more severe than those of the native-born. We see similar trends among Syrians in Turkey, in Jordan, in Lebanon. In a April 2020 survey of refugees in Turkey, 69% reported having lost their jobs as a result of the pandemic, and 93% of those were their family's sole provider. We also saw that Syrian-run businesses in Turkey, refugee-run businesses in Turkey were much more severely impacted and less likely to be able to persist through the second wave of the pandemic. Many migrants in the Gulf countries were stranded after losing their jobs because many visas are tied to employment. And as Mauro mentioned, this put a lot of domestic workers, particularly women, at greater risk, who were either stranded without work or had to choose to remain in a domestic job that perhaps put them at a greater risk of trafficking or smuggling. Overall, remittances in the region and worldwide were more resilient than was expected. There was a drop in remittances, but it was not as great and did not persist as long as was anticipated, given how severe the economic impacts on migrant communities were. It really shows the resilience of migrant communities. But again, in certain countries, this is obviously idiosyncratic in the sense that not every country saw similar trends, and there were large drops in Lebanon and Jordan and other countries worldwide. So this is, not a universal statement, of course. Next slide, please. And again, when you have these mobility restrictions, it's not only affecting migrants themselves, but also the communities that rely on having migrants participate in the economy and help supply chains run smoothly. Next slide, please. So in this graph on the right, these are the share of certain occupations that are filled by foreign workers in the northern Mediterranean EU countries. So, in the top part of the graph, you see the low-skilled occupations. That includes personal service workers, construction workers, cleaners, helpers. And you can see that in some occupations, more than a third of the workers in these northern Mediterranean countries are actually foreign-born workers. And even in the lower half of the graph, in those higher skilled occupations, that being, technology professionals, teaching professionals, nurses, even 6 to 11% of those high skilled jobs in the EU Mediterranean countries are filled by foreigners. And that's not only other EU foreigners, that is the green part of the bar is third country nationals. So you really do see how important having migrants in participating in the economy is to having a functioning economy. And when those mobility restrictions were imposed, it really did create frictions in a lot of supply chains and a lot of services, including health and personal care services. And then in the Gulf countries, where there is a much larger share of the population that are foreign-born, almost, the entire workforce in some of the countries are foreign-born. In Turkey, you see that, for example, 20% of the agricultural workforce is comprised of refugees. In part of the report, we also do a small look at the importance of agricultural workers and foreign-born agricultural workers in Italy in that sector. And so what we saw is when you might notice in your own daily life, the increase in food prices is that when migrants cannot move, there was a huge increase in global food prices during this same time. And in part, that is due to the inability to fill certain occupations due to, frictions in mobility. Next slide, please. And so there are already certain, labor shortages among key occupations in the EU. And so, going up the y-axis here in this graph is the share of EU countries that reported a shortage in an occupation. And going, along the x-axis here is the share of foreigners in that share of foreigners that are working in that occupation. So this kind of upward sloping line, although it seems not so steep, although it is upward sloping, indicating that the more countries that are reporting a shortage and are unable to fill jobs, those are the same jobs that are being filled by migrants. And we highlighted certain, health professions are some of the ones with the greatest shortages. And so when migration flows were stopped, it really did, exacerbate some of those shortages. Next slide, please. And so as Mauro mentioned, these are short-term problems with long-term consequences. And one of the long-term consequences has to do with learning and integration. So there were obviously school closures, and this had an impact on students globally. There are studies we highlight in the report saying that the 4 to 5 month school closures could lead to annual future earnings losses of 2 to 8%, and lead to 7 million dropouts worldwide, which is huge. And so while this affected students worldwide, migrant and foreign-born students, really were, again, differentially more impacted. And that's not for any inherent reason because they're migrant students. It's again because of social factors surrounding their learning environment. This graph on the right is showing that, you know, when you move towards remote learning and you're learning at home, well, if you're a foreign-born student, you're much more likely in all of these countries to not speak the language of instruction at home, which again puts you at a greater disadvantage when you're a child who doesn't have the same linguistic support at home as you would at school while you're trying to learn. The foreign-born students, we have similar graphs showing that foreign-born students were less likely to have a computer and internet connection and different technology, which would make remote learning easier at home. That students, migrant students, were more likely to come from socioeconomically disadvantaged households, and all of these things make those learning disruptions and the consequences of them all the more severe. And this was not only a problem for migrant children and children of migrants, but also for adult migrants who were, and many countries offer integration courses and language programs to help migrants integrate into their host countries and host labor markets as soon as they can upon arrival. And when many of those in-person language and integration courses had to stop meeting in person, some went online and some were canceled entirely. And the ones that went online, perhaps migrants, again, were not as familiar with accessing the programs online. And what this does is it doesn't only, you know, have a short-term implication, but it really does impact the long-term integration and long-term employability and employment outcomes of migrants in their new communities. So the short-run impacts end up becoming long-term consequences. Next slide, please. What's not entirely clear is that, you know, the impact that this crisis will have on my attitudes towards migrants and migration policies. On the one hand, we saw a lot of discrimination towards migrants due to, you know, public health concerns. At the same time, migrants were kind of lifted up as these communities that were filling those key roles, filling those, you know, needed healthcare occupations, and really kind of stepping up to support host communities. And so at the same, you have these opposing forces and attitudes. So it's not entirely clear whether the pandemic will have a positive or negative impact on people's attitudes towards migrants and migration in their communities. And in fact, if you look at this graph on the right, over the past 20 years, attitudes in the EU towards migrants has remained pretty stable over time. And that's, you know, through the economic, you know, recession, that's through the large wave of the large number of arrivals around 2015, 2016 to Europe. And the attitudes of how many migrants of different categories to allow in, according to the European Social Survey, has remained pretty stable. And so it's not inevitable that a huge shock like the COVID-19 pandemic needs to change people's opinions about migrants and migration policy. Next slide.
Okay. So thanks, Jacqueline. I think I'll jump in now to conclude with just a couple of thoughts about policies. Because as we heard, the COVID pandemic highlighted some issues that are very specific to the pandemic. But what we also see is that there are some long-term challenges related to the inclusion of migrants in health systems, for instance, on social welfare, that predated the pandemic, and there were some issues that were already there and that the pandemic just exacerbated. So what we do is to propose an agenda to build resilient migration systems along three main sub-objectives, and also with a different time span. So first of all, we highlight actions to safely continue migration and preserve long-term integration. And this is because, as we have discussed, there were severe disruptions that could have been attenuated if some interventions were immediately implemented. So, for instance, making sure that established health protocols are in place and can be followed. For instance, having facility for quarantine, contact tracing, testing. So being able to activate these mechanisms immediately to then continue migration safely. And we saw that some countries actually did that. Some countries really had need for certain workers and then established these facilities immediately and protocols immediately. The second point is related to what Jacqueline discussed in terms of learning losses and long-term integration challenges. It's important to make sure that migrant students can still, and adults can still continue their path towards integration. So providing support with internet, IT equipment, or even tutors. I think that there is mounting evidence on the impact that tutors and so additional support can have on migrants, children and adults. So these two actions are related to things to do immediately in the short term to continue migration, but also to preserve long-term integration. The second set of action is related to interventions to make migration system more responsive. And so the first in this subset of action is related to how to make sure that procedure can be simplified when needed. So in some cases, we see for migrants to be able to move to countries and for employers to be able to accept migrants, there are a lot of different steps that need to be shown. And so when there is an urgency, migrant can take several weeks and months before being able to move. So in some of these, in case of emergencies, it would be important to monitor occupation in need, strategic occupation, essential occupations, and then allow migrants to easily enter without following the normal long procedures that can cause several delays. And again, this is something that after some months, a lot of countries did. In the Mediterranean, Spain, Italy, simplifying procedure to allow foreign doctors or medical professionals to enter the countries. But not, as Jacqueline showed, it's not only about high-skilled people, it's also about middle or lower-skilled people, construction workers, fruit pickers, agricultural workers. These are all type of workers who really contribute to receiving country's economy, and that it would be good if they could enter more smoothly during a time of crisis. The next two actions are related to the need to allow migrants to access healthcare, social welfare, but also employment support programs during crisis. The fact that, for instance, in the GCC countries or in Singapore, outside of the region, migrants didn't have immediate access to healthcare implied that there were a lot of contagions in that subgroup of the population, and so even if there might be a smaller part of the population, the fact they are not covered by this type of protection may have repercussions. And this is why several countries started implementing vaccination campaigns, but also testing and providing healthcare without requiring strict controls on documents. But again, this is something that needs to be continued. It doesn't need to be limited to the crisis. Same with employment support programs. I mean, when migrants lose jobs, as Jacqueline said, they can remain stranded in receiving countries. And so they cannot move back because they don't have enough money to move, but they can also stay without having support in their receiving countries. So employment support program can help these migrants keep being employed, and also receiving countries keep producing, so filling important shortages. The last set of actions, the last set of 5 actions, are related to issues that pre-existed before the pandemic and that can really need to be addressed to make sure that migration flows can continue in a sustainable way. The first is related to the de facto barriers that Jacqueline mentioned to access healthcare, social welfare. So supporting migrants with language access, to have local and community-based organization that can help migrants navigate complex systems. These are all factors that can help migrants increase the utilization of key services like healthcare and social welfare. Mobility schemes are the key for documented migration. So bilateral labor agreements can reduce the cost of migration. There is evidence showing that. They can avoid smuggling, trafficking, and all the negative consequences. But they can also make sure the migrant can feel labor shortages that exist in receiving countries, so leading to win-win-win situation for migrants, receiving countries, and sending countries. And again, there is a large amount of evaluations showing the importance of bilateral labor agreements or multilateral agreements. Something that came out strongly from what Jacqueline discussed is the really suboptimal situation of migrants' accommodation in camps. So a lot of countries, including in the GCC, they realize how these conditions, this low substandard condition needs to be addressed. And so they have plans to build accommodation that can meet safety and health requirements. To avoid that negative attitudes and negative sentiment towards migrants accumulated during the crisis can become strong long-term opposition to migration, a lot of countries introduce awareness campaign to make sure that true facts were known by the population, to know that there was not such a thing as COVID specifically be associated to migrants, and so to try to attenuate some of the negative stereotypes and myths that could have emerged during the pandemic. And finally, one of the problems as in the migration research that we knew was there and we saw with the COVID crisis is the lack of reliable data on migration, because it is true that it's difficult to track people when they move and to have sufficient information. But now there are new techniques related to the utilization of big data, online sources, even social networks that can help better understand migration patterns and provide support when needed following crises like the COVID pandemic. So just to conclude, since we are in a development organization, one of the questions that we receive very often, and something that we really ask ourselves, is what can we do to support sending and receiving countries? And here are some of the things we have been doing or that we plan to do for receiving and sending countries. So for the first group of countries, we feel it's important to understand their system, how the system works, and how they can be tweaked to become more shock responsive. For instance, in the work that Jacqueline and I did, we realized that in some countries there are some strong requirements of residency for, let's say, about 10 years before having access to some benefits, kind of shortening the period of time during emergency is important. But so in order to know that, it's important to go and understand the system step by step. Then adjust this, making sure that migrants are covered in any plan that is implemented during emergency. So understanding how to target migrants, how to find migrants, because usually migrants are a population that it's difficult to follow over time, as I mentioned before, and to register in official registry. So making sure that mobilizing other stakeholders and other partners, migrants can be included in emergency response plan. Then a lot of countries have implemented seasonal worker programs and temporary worker programs, some of them with success, one with less success. And I think as an international organization, we can support this process of improvement and strengthening of migration agreements. For sending countries, it's important to make sure that when people return, especially after a period of crisis, they can be reintegrated in their sending economy. So reintegration programs is something that we've started doing in some countries, for instance, in Bangladesh, where a lot of people came back after the crisis. Also, some people left to begin with because there were no sufficient employment opportunities. So now that the situation is getting better, actually support the re-immigration of these people, making sure that the health protocols are followed. And finally, also on the sending country side, it's important to support them with creating system to sustainably support migration. So in order to have bilateral labor agreements, it's important to have the efforts from receiving countries, but sending countries also need to have system in order to manage migration more sustainably. In some cases, our help is related to support with building these out-migration systems. So this is all we wanted to say for now, and we'll be happy to answer questions and to have a discussion on these findings. Thank you so much.
Thank you very much, Mauro and Jacqueline, for your sharing the main findings of the report. Really appreciate it. We received several questions in advance, and some questions just received during the presentation. So let me start with the questions that we received in advance. Let me read. It is rather shocking to know that migrants are more likely impacted by the pandemic in many ways. But I wonder, more vulnerable people among the migrants, such as people with disabilities, may be impacted more severely. Do you have any analysis related to this aspect? And if so, what does it tell? So, Mauro, Jacqueline, please come in to make any comments, please. Thank you.
Jacqueline, do you want to start?
Sure. So we don't specifically cover migrants with disabilities in this report explicitly, but one thing that to note is that, as with everybody, people with pre-existing conditions had more difficulty accessing healthcare for their normal conditions due to the COVID-19 pandemic. And because of the, difficulty that migrants face accessing healthcare systems, that put them at a greater disadvantage for those with pre-existing conditions. Another particularly vulnerable group that we kind of want to highlight is, again, as Mauro mentioned, women and children. Because of the occupations in which many women migrants are employed, being domestic workers, they often found themselves in stranded conditions and or situations where if they couldn't return or had difficulty migrating elsewhere, if they were facing, for example, a situation of domestic violence, it was difficult to get out. If they had a problem with their employer in a domestic worker situation, they could often be exploited. People fell victim to trafficking. So women and their children found themselves in more vulnerable situation. And then in general, I think those who were in need of food aid and refugees found themselves in more vulnerable situations, specifically because many agencies were redirecting kind of aid to more COVID-specific purposes, and in which case certain aid that was maybe detracted from food aid or other places. And so there really kind of was a lack of aid going to refugees as well. So Mauro, if you'd like to add to that, if you have anything.
No, I am just to say that it's just continuing what Jacqueline said, that also the closure of facilities, the inability to access, for instance, for children with disability, the closure of school also compounded this effect. So in general, we can see that this is exactly what we highlight in the report when we talk about long-term impacts. So in the short term, there is more of a focus on what happens immediately, but the lack of care that some people may have experienced during the pandemic may translate into long-term consequences. And this is why I think that now that the situation has improved with the pandemic, trying to make sure that those who didn't receive enough services can then now be focus of attention, because otherwise there can be long-term consequences.
Thank you very much for your responses. Let me go to the second question that we received in advance. How should the World Bank collaborate with other bilateral and multilateral donors to strengthen the migration system in the Mediterranean regions? Also, what should be done to guide and influence the policymakers in the Mediterranean countries to strengthen the migration systems? Mauro, please.
Yes, so first of all, working at the bank during the pandemic has been really eye-opening, even more than usual, because you realize how much different organizations and different efforts can come together to try to address the crisis. I think that in the first month of the crisis, the World Bank has mobilized a lot of funding in partnership with other organizations. So I think that this really has shown the best of the institution. On the agenda of migration and refugees, we do work closely with UNHCR, with IOM in some countries. And I think there is how to make sure that different services can be provided. So in some countries, it's important to first make sure that people get the basic services. So legal support, cash transfer, understanding of how to move in a society which is new. In some cases, people were not planning to be there. So on this collaboration with UNHCR have been key. In other countries, we focus more on the integration agenda. So how to make sure that people, once they arrive, they actually can get support and become independent. So these are examples of areas in which we work on. Now, specifically on how to build a more resilient migration system. I think that some of the advantage of multilateral organization is that we work with sending countries and we are in contact with receiving countries as well. So kind of having some convening power and try to make sure that when there is a gap, when there is a need, the two parts of the market can meet each other. So we know that in the African continent, for instance, the median age in some countries is very low, while in Europe, the median age is very high and there are labor shortages. So how to design programs in a way that then workers, job seekers from the African continent, for instance, can feel shortages in Europe. On this, there have been some pilots of bilateral programs. I mean, one example are the Global Skill Partnership. So colleagues have started, for instance, looking at how Nigerians could go to the UK to fill some labor shortages. So I think in a way, working the collaboration between sending and receiving countries also with different players is important. Not only multilateral and not only international players, but also and especially local players that have a lot of knowledge on the local context, and they're always a good resource of information and collaboration.
Thank you very much. We received the questions from Professor Yoshino and Naoki Yoshino. Thank you very much, Yoshino-sensei. Let me read. There are two questions. Let me read two of them together. There are many illegal agents who assist migrants to move from their own countries to other countries by various transport. Are there ways to stop illegal agents to work? How much do they earn in each year as a whole? That's the first component of the question. Second component, to stop illegal migrations, economic growth, social care of the developing countries are needed. However, it may not be easy to achieve stable economic growth of all those countries without huge assistance by outsiders. But what would be the best solution? So these are the two comment from Professor Yoshino. I'd like to ask Mauro and Jacqueline to come in.
Jacqueline, do you want to go, or shall I?
So I guess I can start on the first question if you want to move, and then you can add as well. Regarding agents who are facilitating migration, I think as Mauro pointed out in the beginning of the report, what we saw during the beginning of the pandemic is that when legal channels closed, there was this dip in asylum applications, in visa applications, and they didn't fully recover. But when you look at actually the movement of people in land and border crossings, they actually increased, and along the channels that were more dangerous. So through the Greece channel, which is a land border, migration flows slowed. But then, when those channels are closed, and we also in the report look at the closure of land and seaports, as well as the closure of airports. So when you have kind of legal channels that are closed, it doesn't necessarily mean people will stop moving. And so what we did see, as Mauro mentioned, is that the push factors that are pushing people to move, and the gaps, the age gaps, the wage gaps, the political stability gaps that are driving people to move, don't stop just because legal avenues are closed. And so that is why we saw an increase in the need and demand for smuggling. And with that increased demand, we saw an increase in the prices for smuggling and a shift towards more dangerous routes for smuggling. And with that, an increase in trafficking and exploitation in the smuggling networks, because obviously there are some bad actors there. And so I guess the solution is to create these bilateral partnerships, as Mauro was mentioning, that can open up legal channels, those mobility schemes that he's talking about at the end, in kind of recreating these systems and recognizing that this report started before COVID, and then the point was to address the systematic issues in migration systems in the Mediterranean region. And then COVID basically just exacerbated all of them. It highlighted all of those existing structures. And so, in terms of, what somebody would earn, I can't say, but I do know that those prices were increasing during the pandemic, and how to stop them is really to create those legal channels to make sure that the asylum process, for example, doesn't take forever, and to make sure that there are mobility schemes to fill labor shortages that are circular mobility schemes for those who perhaps want to do seasonal work, and so that those push factors are not driven to kind of informal networks.
And maybe then I can take the second question on the role of migration and development. I think that the main point of the question was that. And I think that sometimes the discussion is whether we should think of facilitating migration as opposed to having people stay and promote local development. And I think it's not a dichotomy. I think the people move in search of better economic opportunities, and it may take time before consenting countries can create those opportunities. So keeping people from moving, it will be difficult. But at the same time, it's possible to think how migration can be an agent for development. And for instance, here, the case of a country like the Philippines in the region, that I'm sure that you guys know very well, is a country that realized that migrants or immigrants can be a resource. And migrants can be a resource by sending remittances. They can be a resource by creating knowledge networks. They can be a resource by investing. So the question becomes how migration can be leveraged to stimulate development. And for instance, how remittances can be channeled to productive use in a way that then more businesses can start, that other local people can be employed. And now migrants who return can then be supported to create this condition for economic prosperity. And here in the region, Egypt is a very good example of a country in which there is evidence that when migrants return, they do create business and they do employ locals. So in a way, there is a way to use migration as an agent for development, while at the same time investing in development in sending countries. Migration is only can be a part of the development agenda, but then there are still other parts of the development agenda that cannot be ignored.
Thank you. We had a pleasure of having Mauro Testa Verde, the senior economist in social protection and jobs, global practice of the World Bank, connecting to us from Washington. And we had Jacqueline Pavillon, who is the deputy director at the Center for Migration Studies of New York, connecting with us from New York. Thank you very much, both of you, for your time. Really appreciate it. Thank you.
Thank you. Bye.
Great. Thank you very much. We have interesting seminars, online seminars coming up. Next week, in fact, we have 3 morning seminars. First one, Tuesday, October 18th, 8 a.m., featuring the South Asia Economic Focus. And second one on Thursday, October 20th, again 8 a.m., featuring Africa's Pulse, which is the latest version. And then lastly, we have the another seminar on October 21st, Friday at the same time, same 8 a.m. Time. This is going to be toward safer and more productive migration for South Asia. So another migration report, but this time focusing on South Asia. So with that, I'd like to thank everyone for watching our seminar. Please check the World Bank Tokyo office website for more information. Stay safe, stay healthy. See you next time. Thank you very much. Thank you.